Hi everyone, this is Ricky Spencer and welcome to another of our Voices series for the sociology of media. And today we have as our special guest Michael Shanahan. And Michael is a current research student, advocate, healthcare practitioner and healthcare consumer. Michael is a student at QUT, which is Queensland University of Technology, researching anxiety in Corpus Callosum Disorders, and he is also the Vice President of the peak body in Australia for Corpus Callosum Disorders. And the Australian disorders of the Corpus Callosum, I hope I'm saying all that right. He is a registered nurse with a Masters of Nursing and has a Corpus Callosum disorder himself. Michael is passionate about both biomedical and qualitative research impacting people with a disability and neurodiversity. Disseminating research findings for a lay audience and connecting people with a Corpus Callosum disorder to their wider community and to experts and advocates that can help them. As a registered nurse, he is also interested in wound care, chronic pain, palliative care, and general medicine. And as someone with a disability, he is interested in impacting the healthcare system and society at large to combat ableism. Michael, welcome. Just reading all that, I'm like blown away. So thank you for coming into our space today.
Thank you for having me. And I'm sorry that you had to say all that about me. It sounds a bit too much.
No, I was going to ask you first because, and for everyone else, can you maybe, as you begin our journey of telling us about your life, perhaps even tell us a bit what is the corpus callosum for some of our audience, and what does it mean to have a disorder of the corpus callosum? Am I saying that correctly? Please correct me if I'm not.
Some people say it the way that you say it, but most people say corpus callosum, but I don't think it matters. Okay. So in the community, we say if you haven't heard of the corpus callosum, it's because you have one. It's not something that most people are aware of. If you've done some kind of healthcare degree and done a freshman year anatomy course, you would have come across it. You wouldn't learn anything about it, just that it's a thing, and that's about it. It is quite complicated. Though I have an MRI atlas of the corpus callosum, and it's like half as thick as the first Harry Potter book, which is like, it's a footnote in introductory anatomy courses, and no one learns anything about it, but it is actually quite complicated. It's part of the brain, and it's part of the brain that connects the two hemispheres together. So when we're doing stuff that requires the two hemispheres to communicate very effectively, that's when we're using it. And it's also a way of blocking information from crossing over to the other side when one side needs to focus on a specialized task, so it's not getting bombarded with information. So socializing, what we're doing right now, requires efficient use of multiple parts of the brain, because we are talking to each other, listening to each other, thinking about what we're going to say, reading body language. Obviously, if we were in person, it'd be a bit more of that. And sometimes we talk about the challenges of and the ineffectiveness of meeting on Zoom, and that's because we can't do the full communication stuff. Abstract thinking is another thing that the corpus callosum facilitates, so maths and sensory processing and coordinated movement, because we've got limbs on both sides of our body, eyes on both sides of our body. All that data has to cross the midline of the brain where the corpus callosum is, that connects the two sides. So I hope that makes sense. It's a bridge. It's a bridge that connects the two hemispheres of the brain together. And when we have a corpus callosum disorder, we have a congenital anomaly, what used to be called a birth defect. So we're born without it, and our brain makes sometimes global changes, lots of changes to accommodate for that part of the brain not being there, and having a way to have the two sides communicate. So it's a neurodiversity, like autism or ADHD, where the brain is wired differently rather than thinking of it as a purely medical problem. It's a different way of being. And about 40% of people with, I'm going to call it a DCC, just to make it easier, 40% of us have an autism diagnosis. And people with autism that don't have corpus callosum problems, they have differently shaped corpus callosums compared to the general population. And people that have a DCC that don't meet the criteria for autism, they have subclinical symptoms of autism. So there's a bit of an overlap there. There can be intellectual disability, there can be learning disability, mental health and physical health stuff going on. The main thing, the most common thing is the neurodiversity diagnoses, like the autism and ADHD and dyslexia. And I think the key stuff is that it's really rare. So it affects 1 in 3,000 people. It wasn't commonly diagnosed until after I was born, because it's of a technology thing. It's diagnosed during pregnancy. So I'm 30. Anybody that's my age or older can only find out from an incidental finding. I had a brain scan for an unrelated health problem. And there's not going to be a time in your life where you go to the doctor, say you have a problem, and they go, oh, we're going to scan you because you might have a corpus callosum disorder. Most GPs and that sort of thing haven't come across corpus callosum disorders themselves. So it's quite varied in cause. It's most of the time we don't know what the cause was. It can be genetic, it can be environmental, and it's very variable in presentation. So the degree to which it impacts your life and the way in which it impacts your life is quite varied. So it's very complex and not much is known about it, which is the main thing. Lots of people that specialize in it are overseas, and there's not a lot of research going on in the space. There's more now than there ever was, but there's lots of need for it. And getting recognition with the NDIS, with the healthcare system, and in the education system is quite challenging. And one of the things that we're seeing change, we used to try and get diagnosis of autism, even if we didn't meet the criteria, just so that we could get help, just so we get funding in schools and stuff. And we don't want to do that. We want tailored help that is relevant to our condition and not just get a different label just for the sake of it. That used to be something that happened quite a bit, and it's happening less and less. Yeah, so that's I think an overview of this. Some explaining needs to happen because most people probably haven't heard of it. And it crosses over. It's a bit of there's a lot of disability stuff happening, but there's a lot of rare condition stuff as well. And it's also we're in the neurodiverse space and have inherited a lot of autism culture from our members that also have autism and have brought that that language of neurodiversity with them into our space.
Oh, well, thank you for that, Michael, for giving us an insight into this really interesting area. Can we now take a step back into your journey of your life? And what was it like, Michael, for you growing up? And when was it the first time as a child that you thought, why am I a bit different from other people?
Yeah. So I felt like I had a problem when I was about 16. Earlier than that, my mum certainly thought I was a bit different.
Mm-hmm.
Took me to doctors to get me sussed out. I didn't socialize with other kids. I had a lot of the stereotypes of autism play. I think we sometimes use that term. I don't know if that's the right term, but like lining toys up in a row.
Yeah.
And we used to think that was a bad thing. And I had a preference for playing by myself
Mm-hmm.
as a young kid rather than playing with others. So it was pushing me to engage in group activity and that sort of stuff. I didn't think of myself as bad then. I was just had a lot to learn about what was expected of me. And something that's quite common for our community is to not necessarily notice too much in the way of challenges until the teen years start to happen. Obviously, my parents noticed things before I did, but our bodies go through lots of changes in adolescence, including the corpus callosum, and socializing becomes a lot more complex and a lot more important when we're teens. So kids with a DCC can sometimes have trouble keeping up. At the same time, academics, it's getting harder. So lots of stuff is getting harder all at the same time. So I was always sort of thought of myself as a bit of a loser because I wasn't social and couldn't really socialize well. And that became more of a problem as a teenager. And the other thing that was starting to happen that bothered me, I could sort of live with being a loser. And I also wasn't very good at sports. So that's actually something that bothered me. Just to go on a tangent, people always talked about, and they still do, talk about like focus on what you're good at. You know, don't worry about other stuff. Just everyone's got a thing. I never had a thing. I never had a thing that I was good at that I could focus on and be like, oh, I can get bullied at school. I reckon, you know, this is bad, but I've got this. I never had. I still don't have a thing that I'm good at. So yeah. I was having trouble concentrating at school, and towards the end of it, particularly, we were expected to do about 4 hours of homework after school, as well as lots of co-curricular activities. So for me to not be able to concentrate well, there's not a lot of time left in the day for error and for not being able to focus on schoolwork. So I really struggled with high school. I actually found high school a lot harder than the rest of my life so far. Like it was harder than uni, it was harder than having a job. It's harder than living on my own. I don't know if that's just me or if there's other people out there that feel the same way, but I found high school quite challenging. And I guess in a way it prepared me for uni, which wasn't as hard. I struggled with the workload, couldn't concentrate, and kind of couldn't get the help that I needed. So I went to the school counselor, then I went to a psychologist, then a psychiatrist. I got diagnosed with obsessive compulsive disorder and depression. I did CBT, cognitive behavioral therapy, and started taking antidepressants and tried a few of those and didn't really get anywhere with that. Cognitive behavioral therapy gave me some tools that were very useful in terms of managing myself and understanding a little bit about anxiety and what was going on there. But I never really felt like my experience mapped on to what I read about obsessive compulsive disorder. And I think OCD is very complex and it's not always about the stereotypes that we hear about hand washing and all that sort of stuff. So a lot of what we experience with OCD and the treatment of it doesn't map onto that sort of stereotypical image and pathway of that experience. So I had a brain scan when I was 19, had not done well at high school, didn't get the score that I wanted, got into uni though, and was struggling with uni in a similar way, not being able to concentrate on schoolwork, and it's just a anxiety thing, having lots of anxiety about academic performance, and managing my time now with the tools that I had, that I was given so much focus on time management and scheduling, but when it came to sitting down and doing the work, all that stuff didn't really matter. I still had trouble actually concentrating. And I had stopped. I decided myself to stop taking antidepressants, which is not something that anybody ever recommends. But I didn't feel like they were doing anything for me. So receiving the scan, my GP hadn't heard of the condition. We looked it up on Wikipedia together, and we sort of decided that it wasn't related to the stuff that I was experiencing. And I found that very interesting. So the question then was, what is the relationship between the person that I am and essentially this sort of hole in my brain? Like, how can it be that I've got mental health stuff going on and a physical difference in my brain and it not be related? And it turns out with a lot more digging that it is related. There is a relationship between these experiences and the condition that I have, and it's not well researched, not well researched as it could be. I know a lot of the researchers in the space. They're doing amazing work. They've done a lot of research on me. I've been involved in a participant of about 20 or more than 20 studies, doing psychological testing and being in an MRI and doing stuff while my brain is being scanned, all that sort of thing. I have used that experience to motivate me to do my own research in this space about anxiety in this context, because there's not a lot of research specifically about anxiety. So yeah, looking it up online, there's lots of information about all these different people, and because of the variation, there's a lot of it didn't relate to me. So I did feel discouraged initially. I did feel like maybe it isn't related, and I was fortunate to have the education that I had, fortunate to have parents and to a degree a school that acknowledged that I was weird and different and didn't fit in, but they were going to try and do the best for me anyway. I had that experience in primary school and not in secondary school. All the teachers felt like there was something wrong with me, but we couldn't get a diagnosis, so they were like, oh, we'll try and push him to play with the other kids, push him to not do that sort of stereotype of autism play type stuff, which I don't think they do that anymore. But that's what they felt was the right thing at the time. So they were trying to do the best thing, even though I didn't have a diagnosis. And certainly, like, that was the way they thought of it at the time, that there was something wrong with me. We don't use that sort of terminology now. But yeah, it took a lot of motivation to keep searching for information, and at times I sort of gave up. And eventually I found OZDOC, which at the time was a very small organization. It had been around for a couple of years. And it was a group of parents mostly with newly diagnosed kids that had formed a Facebook group and then become an incorporated charity, trying to hold a conference. And then we've held several, got researchers to come from all over the world to Australia to talk and give advice to lots of our members. Obviously, it's all happened on Zoom in this COVID world that we're living in, which is a lot cheaper than paying for airfares. And it's been great in a sense because we've been able to do all kinds of new things. But yeah, joining that group, I did it because I wanted to do something with my life and take my experiences to make some use of them. I also wanted to learn more about myself, and I just found all of these people that had some experiences that were like mine and many that were not. So I just found like our whole community needs help. So I feel like I can try and make myself useful here, because I had never, and I still don't, find myself a particularly useful person. But engaging with this community that then engages with the broader disability community, the word useful is something that I think the disability community has wrestled with. It used to be my favorite word. It used to be what I wanted to be. I wanted to be useful. And now I don't know what that word means anymore. And I think it's usually used in a harmful way. And I don't know if your experiences with your community sort of can gel with that. But yeah, so I've had to confront a lot of the ways that I use language. Like I used to call myself stupid and lots of other horrible things. And I haven't really, like, I don't think much of myself, but the way that I use language about myself has to reflect somewhere at some point views that I have about the world. And I really need to challenge that in order to challenge how I see the world, because people that are different aren't stupid. You know what I mean? So, and my whole life, there's been lots of moralizing of my problems, and I'm open to being a person who has. I think of myself as somebody who has a brain that's wired differently, and I've got to just work with what I've got rather than having a medical problem, although it's only recently that I've thought of myself as not having a medical problem. But I could have a medical problem as well and moral problems. But if I hold on to that too much, am I taking that to my judgments of other people? I've got to be really, analytical about how I think, and in that way, I can be useful, maybe. I've been preaching a lot of this stuff and not thinking of myself in the same terms. And I've the journey to apply it to myself and really be introspective has been something that's only happened in the last couple of years. And in part, it's been because of the Human Library Project, which I'm also involved in. And that's a really cool thing that I have been involved in, where it's all about challenging bias. So I'm a book in the Human Library. They hold events, you can come to them, and you can say that you want to read me. So you have a chat with me for about half an hour. The title of my book is Invisible Disability, and you can ask me any question that you want for half an hour. And it's about challenging biases. We all have biases. We all judge people. It's a natural part of being a person. But we want to be good people. So we want to challenge where the biases come from and what they're making us think about other people, and how we can revalue and value people that we have judgments of. So I'm a book in the Human Library that's trying to challenge people's notions, and it's challenging my own as well.
And how do people get, this sounds like a fascinating project. How do people get access to this Human Library?
So you can Google the Human Library Project, and they they're on social media. They advertise their events all the time. They're doing some stuff on Zoom, obviously, in the times that we're in, but they also do stuff in physical spaces as well. And there's not a lot of it in Australia. It is a European and American thing mostly, but there's more of it happening on Zoom, and there is some stuff that does happen in Australia as well.
And how has that participation for you changed you as a person?
It's really sort of confronted I know a lot of the right words to say and what I want to advocate for other people, and just thinking of myself as a part of that group, and thinking of how my language about myself might affect others. Thinking of how I describe myself, and then if somebody else feels that way about themselves, and they think, oh, well, he's describing himself in a negative way, because I do it as like a humor thing. And then if I say something bad about me, it's like a protection thing, so no one else can do it. I've got to get rid of that, because it makes other people feel bad about themselves. It's not about me. It's about how I affect other people. And also, like, the first one that I went to, I don't know whether I had read a list, but I was looking, it was a Zoom meeting, and there's all these faces. And I know that there's a gay guy. I know that there's a guy that's in a polyamorous relationship. And I know that there's this, that, and the other thing. And I'm like, oh, I bet that guy's the gay guy. And I bet this guy's this. And I'm doing the thing that we're trying to combat. Like, you know what I mean? Like, I'm judging them. And that is what we're supposed to be combating. And I'm like, oh, like this is the teachable moment for myself. I'm just gonna like step back and be like, hang on a minute, like, how much do I actually know about this process of biases and judgment, and really anything at all. Like I've yeah, just a bit of an opportunity for introspection and thinking about practicing what I preach, and being a bit more involved on a daily and lived experience basis in what I want to see in the world, if that makes any sense. Being a part of the community in a way that reflects that I've living the changes that I want to see. Yeah.
And how do you feel that this human library would challenge some people's notions of ableism in meeting people who are living full lives with disability?
I think one of the things is that we might be afraid to ask questions in a normal environment, for risk of offending people, for risk of sounding off base. And it's a space where we're not in a normal environment, and you can ask those questions. And there's moments for the books to take something that somebody said and go with it. So, for example, I was talking to a person who identified as a lesbian woman, and they had readers from a foreign country who said something to the effect of, we don't have people like you in our country. And so that was a moment for that woman to talk about the LGBT community in a way that those people hadn't heard of before, because there probably is lesbians in that country, and in every country. So disability can be spoken about in a variety of ways, because there's a variety of interpretations of what disability is, and we can take maybe the one interpretation that that person has and expand it, and we can talk about what ableism is on a day-to-day basis in a person's life. And I think people can think of examples of ableism. I think people have like a general understanding of what it is, but we can go deeper and talk about how insidious it is, and talk about what it would mean for people to be included in society.
Wonderful area to really delve into, and I would assume both the participant and the human book do get so much enrichment out of it, and somehow get to understand, as you said, the human condition from having that real deep dialogue that so many of us strive for. And now I just want to reflect, Michael, on your other work, where you're the in the other space, where you're the vice president. Is that correct?
Yeah. So we're called AusDoC, or Australian Disorders of the Corpus Callosum, and we're the peak body in Australia for the condition. So we started out, before I joined, it was a Facebook group of mums of kids with the condition, and we've got lots of people with lived experience on board doing stuff. And we do more than just invite people with expertise from overseas over to give us information, although that is very powerful. We do a lot of community events where people get to meet each other, and a lot of these kids are getting bullied at school. They don't have people in their lives because it's a rare condition that they can relate to, and they get to have events where they meet people and then go away and stay in touch, and they get to just share moments where they see people like themselves. And I think that's a really powerful thing. It's been a powerful thing for me as an adult to witness and also to be involved in. And apart from educating our community and allowing them to connect, we're looking at self-advocacy and empowering particularly the adult members of our community who have the condition. And we're looking at growing that to the younger members, the teens and the kids.
Is it something also, Michael, that special teachers who are special education trained, who want to learn more, is this a space that they can reach out to in terms of, to get sort of, I guess, a greater understanding of, I guess, more ways to be more effectual in working with students who have these conditions?
So we have a website that has resources on it. We also give our members information to take to their teachers. Fantastic. And we've had events where healthcare people and education professionals have come to learn about the condition, and we've either had events specifically with a component of it for that, or worked with other organizations where that was what it was about. And so that's primarily been people who have a patient who or one of their students has the condition, and they've either come themselves or brought people with them who are also interested. So yeah, it is education is a big area that we want to have an impact on. And the main way that we've done that is to reach out to our members and provide them with things that then they can take to educators as well.
Are there any stereotypes that that you would like to dispel on this conversation today, that perhaps that some people in the community or even in education spaces or in healthcare spaces misinterpret or don't have a clear idea of working effectively with people?
Yeah, so one person that probably the only person that people would have heard of that has a corpus callosum disorder is Rain Man, the movie from the 80s.
Yes, yes.
So that person was a real person, Kim Peek, and he was very kind of larger than life, like unique, like very particular individual.
Mm-hmm.
And I think a lot of stereotypes of disability, I don't know if they've emerged from him, but they relate to the image that he was in the movie, and maybe perhaps in real life as well. So just that whole thing of like, he was called an idiot savant at the time, which is not a term that we use anymore. So problematic. And it's not just the term, it's what the term means. And we've got rid of the term, but we still hold on to the meaning. So this person who has amazing abilities in one area, but then not in others. There's a lack of richness in that description of him that I don't like. The stereotypes that I want to combat, I want to challenge the moralizing of the problems that people have in like broader society in general, but particularly when it comes to mental health and disability and perceptions of neurodiversity as it pertains to probably people think of autism when we talk about people who are unemotional and unable to connect with other people. That's not true of autism, and it's not true of other neurodiversity, and it's not true of corpus callosum disorders. That'd be the big thing. Yeah.
I was going to sort of add to that too. What do you see are some of the issues that confront people that you've come across in terms of relationships and forming relationships, who want to disclose to their partner or potential partner that they have neurodivergent part of their essence? Is it something that still people that you find challenging?
Yeah, so like I'm married myself. When I first started going out with the person that I married, I was upfront pretty early on about the condition, and that was because I can't be in a relationship with somebody that doesn't want to be in a relationship with somebody that's got what I've got, and for any reason, like that's their personal choice. There's a chance that if we have kids, that my children might have the condition as well. If they don't want that, then it doesn't really matter what I think about it. We can't be in a relationship. So if we get that out early, then I think that allows both people to then go on and be in a relationship with somebody they want to be in a relationship with. So I think there's lots of challenges for neurodiverse and disabled people in that space. And there's something about how we make spaces in public where we go and do that sort of the dating stuff, the nightlife thing, and how it doesn't really optimize the experience for neurodiverse people. There's something about the way communication in broader society works that disenfranchises neurodiverse people at large, but particularly I think it's hard for neurodiverse people to engage in like typical dating talk and stuff like that. And people don't have a perception or appreciation for the way that neurodiverse people talk, so that sort of cuts them off from that world quite often. And there's something to be said for spaces where neurodiverse people go and can share moments together as neurodiverse people with people that understand them. But then I wouldn't want to take that. I think like that's like awesome in our community and certainly in other communities as well. But I don't want that to be taken and then to mean that like only neurodiverse people can date other neurodiverse people. Like I think it's really valuable, but I don't want to like say that we've got to have a segregated society, because I think that's like what the implied meaning of that is. Like there's extraordinary value in it, but and then the other side of it is like I don't want to particularly with straight cisgendered women say like, oh, if there's this guy who's doing something that you don't like, you have to give him a chance because he might be neurodiverse. Like what would be the thing there is talking about how neurodiverse people communicate and maybe challenging some of the preconceptions so that what people can say that they don't like isn't the same as how neurodiverse people communicate, if that makes any sense. Like,
it does.
Yeah. We have a professional that works in the space of sexual health and the disability community that comes through our events, our OZDOC events, and talks to people about this issue. Can I give them a shout out?
Of course.
So they're in Brisbane. Natasha Alexander, Dr. Natasha Alexander, she runs a private practice called Consentability, and she's amazing. I could go on, but that's all I'll say. Just can give lots of advice about sexual health for disabled people, and relationship advice as well. And she's been amazing in that space, and that's really her knowledge area. It's only my knowledge area in so much as like what I've seen through lived experience. Yeah.
And now, Michael, let's go a little bit about your own your journey. I was about to say a little bit. It's not a little bit. It's a big journey. You've done a Masters of Nursing, and what did you take the most out of from that course?
Yeah, so I wanted to really expand my core knowledge of nursing. I could say a lot about nursing education, and that's not what this is about, so I won't. But I wanted to learn more and to know more. There was a lot of core nursing stuff in there, but what I am interested in and what I was able to explore, and then what it gave me the opportunity to do was to do the course that I'm doing now, the sociology component, where we challenge what we know about healthcare and when people who are patients who come into the hospital, they are experts of their own selves, and sometimes their experience in hospital doesn't reflect that, how they're treated by medical staff. And at the moment in my academic journey, I have no idea what healthcare is anymore. Like, we've been learning about different ways of perceiving healthcare and asking the question, like, what does it mean to be healthy, and looking at different frameworks of health. And I every day I feel like I know less, and there's very little that I know anymore. Like, I used to, if I was a freshman in freshman year, I mean, my bachelor's degree, I could tell you exactly what healthcare is, and I don't know anymore, because it's a little bit more than the biopsychosocial medical model. It's a little bit more than holistic health if you take holistic health out of a nursing textbook, because holistic health, as it's described in a lot of nursing text, is underwhelming. There's a lot more to holistic health than there is if you get someone from that medical model to describe it to you. I am really concerned about when I'm wearing different hats in the disability space and the healthcare space, that there's a discrepancy between the two. So one thing that I didn't know when I started my academic journey, that there was a disability sector. I thought it was part of the healthcare sector. I didn't know there was a separate thing. I had no idea, and we didn't touch on that. And depending on how you define disability, almost 1 in 5 people in Australia have a disability. So we're not talking about a small group of people. And on that note, there's about 2 million people in Australia that have a rare condition. So that whole thing of the unifying experience of having a rare condition, which are often disabilities, is you go to the doctor and you can't get help because they've never heard of the condition. And the specialist in your thing is like not in Australia, not accessible to you. So that's really frustrating when you go and get medical help and you know, apply for NDIS stuff and all that sort of thing. So we're not talking about a small group of people when we're talking about rare conditions, which you would assume by the name rare conditions, but there's so many of them that have that shared experience that I just feel like there's a lot of connection between the two. It's very frustrating. So I sometimes feel like I'm an outsider in the disability space because I come from the medical model world. And then I feel like an outsider in the nursing world when I talk about like disability justice stuff. And I feel like we don't need to be on separate pages. There has to be changes to the healthcare system so that it's feedback. What the disability world is talking about when they're saying that there's problems with how they get treated in the healthcare system, that's feedback is an underwhelming term to describe it, but we need to change the healthcare system so that the disability experience has been listened to, is mirrored in that. It's not going to happen overnight. How we do it is going to be complicated and take a lot of time, and it's going to require expanding our understanding of healthcare beyond medical model stuff. Yeah.
And your current research at the moment, what is your aim at the moment with your research? What are you exploring at the moment?
So I'm exploring lived experience of people with a Corpus Callosum disorder, and particularly anxiety. So their experience of it, how they would describe it, and how they're dealing with it. So there's lots of anecdotal information about this topic. There's not a lot of published literature, and that's what I want to look at. I want to explore the phenomena of anxiety in the Corpus Callosum disorder context, because I feel like it being a neurodiversity, there's a little bit more to it than what we understand about anxiety in other contexts. I think both things, like anxiety is a massive topic, and there's lots of different facets to it. And so is neurodiversity, and so is Corpus Callosum disorders. And the lived experience stuff, the qualitative stuff, we haven't got a lot of research, a lot of qualitative research. We haven't got a lot of research that's putting their experience at the front and center. There's a lot of medical stuff, a lot of empirical science stuff, which is fantastic and has been very valuable to us. And we can take that and expand on it by engaging in the lived experience. And the lived experience offers us more than we can find out with I don't want to call it normal science, but that's the word that comes to my mind, because it's when we think of science, we think of quantitative medical research type stuff. People with the Corpus Callosum disorder and people with disability have a richness of knowledge of what it's like to be them. So where else could we get the information from when we're studying this topic? Like, we're going to talk to the people that have the condition themselves in a variety of ways to get a richness of information. But rather than studying people through a psychological lens, rather than looking at MRIs and stuff like that, people are already doing that. So I'm moving into a space where there's not a lot of research being done and getting information that can't be got in other ways. And I do have colleagues that are doing similar qualitative research in the space of Corpus Callosum disorders that are looking at different questions. So I'm not the only one. I'm not that special or anything. And they're ahead of me in their academic journeys, and they've inspired me to go into the specific direction that I've gone in terms of choosing qualitative research and that sort of thing.
We look forward, Michael, to hearing more about your research as you progress and keep track on your journey. And just before we wrap it up, I just want to ask you about the future event that you're about to appear in. And that's your TED Talk.
Yeah, so I'm doing, it's a TEDxQUT. So TEDxQUT has been a TEDx event that's happened at Queensland University of Technology for a number of years. I'm going to the one this year, and I'm talking about what I've learned from the world of Corpus Callosum disorders. I don't want to talk about a condition that no one's ever heard of, and probably, like, they get to meet me and then probably never meet somebody with the condition ever again. And I could talk about like specific like scientific data and that sort of stuff, and then it just sort of goes in one ear and out the other. I want to talk about ableism and the disability community and what we can do to challenge ableism, and just go on a journey through the world of Corpus Callosum disorders to draw on that, because that's what I've gotten out of this experience, and I think that's what other people can get out of it, rather than just some data on the part of the brain that they didn't even know they had, kind of thing. So I think that what people are going through in Corpus Callosum disorders, it's a microcosm of neurodiversity, disability, and rare conditions. What we've experienced and learned from our lives and advocating for people with this condition is really we're not just this tiny group. We're holding a mirror up to the world of disability and rare conditions and neurodiversity as a whole. We can do a lot for these communities, and ultimately a lot for everyone, if we take on board what the social model of disability has to offer in terms of allowing full participation of disabled people in broader society. And I personally think that neurodiversity is very related to that. I understand that some people use the word neurodiversity completely outside of the context of disability, and I respect that as well. But yeah, that's sort of what I want to delve into in that talk. So that's happening next month.
Well, we definitely look forward to that, and we'll be keeping an eye on that and letting everyone know where they can reach you to hear that great talk. Michael, it's been an absolute pleasure, and thank you so much for sharing your time and providing us a snapshot into the world of Corpus Callosum, and having a lived experience and showing us the uniqueness of living with a condition that has obviously, well, for I see it as it has made you a unique person, and that I do know you, and I think you're a remarkable person in that you care, and I hope to hear more of you in the future in this space. Thank you for your time today.
Thank you for having me. It's been great to be a part of this, and I really appreciate you giving me the chance to come here and talk about this. And there could be no better person than to ask the questions that you've asked me than yourself, with all of your experience. And I'd be happy to come here again and talk, if just to hear more of what you have to say and to ask. So
you're so kind.
Very happy to be a part of it. Thanks.
Thank you.